We will be reviewing the appropriate specimen collection of the upper respiratory tract for a patient with or under investigation for COVID-19. This includes nasopharyngeal or NP specimen collection procedures. Collect the necessary specimen collection devices: 1 red or blue VTM vial, 2 small specimen biohazard bags, 2 patient labels, a fine-tip Sharpie for labeling, EPA-approved disinfectant wipes for emerging pathogens, hand sanitizer, a sharps container, and a flashlight. Prepare the 2 labels. One label will be for the NP specimen tube, and the other will be for the outer bag that contains the specimen tube. Each label must contain name, date of birth, medical record number, date and time of collection, the specimen source, and the initials of the colleague collecting the specimen. Place the label over the top of the label that is already on the tube so that it does not cover the bottom of the tube. Lab must have visibility to the bottom of the tube in order to safely pipette the appropriate amount of testing. Prior to entering the patient care area, don all PPE required for the care of patients with or under investigation for COVID-19. This includes gown, N95 respirator, eye protection, and gloves. Verify the patient name and date of birth and cross-reference with the labels that you have. Explain the procedure to the patient. Try to anticipate how the patient may react. Consider having a colleague or partner to assist if you are caring for someone who may try to move their head, push you away, or reach for the swab, such as a pediatric patient. Position the patient for comfort and to facilitate safe specimen collection for the swab. Raise the head of the bed and place a pillow under their shoulders. This allows the patient to tilt their head back for the NP swab. If the patient is in a chair, place a pillow behind their shoulders to allow them to tilt their head back. Disinfect the bedside table with an EPA-approved disinfectant wipe. Lay out all supplies on the table in a manner that will help facilitate specimen collection. Perform hand hygiene over gloves. And place absorbent material over the patient to protect their clothing. You may offer a tissue to the patient to clear their nasal passage, and because specimen collection may cause tearing, sneezing, coughing, or gagging, inspect the inside of the nostrils using a flashlight to ensure there are no obstructions, such as a deviated septum. Place one hand gently on the patient's forehead to keep the head from moving. Have the patient squeeze their eyes closed to inhibit the sneeze reflex. Stand to the side to avoid being in the splash zone if the individual sneezes. Insert swab into nostril, gently rotating the swab inward until resistance is met at the level of the turbinates. This is the distance from the nostril to the external opening of the ear. Rotate the swab a few times against the NP wall to extract epithelial cells. Withdraw the swab and your hand from the patient's forehead. Place single swab in container with transport medium. Break off the end of the swab to enable cap to cover and secure in place. Tighten the cap. Dispose of the broken tip into sharps container. Disinfect the specimen tube with the disinfectant wipe that is laid out on the table. Place the tube in the specimen bag and seal. Disinfect the specimen bag with disinfectant wipe. Place the specimen bag into the second specimen bag with a patient label that states the contents, NP. Perform hand hygiene. Disinfect the outer specimen bag. Pass the clean bag to a colleague outside of the room or doff PPE and exit the room with the specimen bag. Double check that the outer bag is labeled with NP prior to taking the specimen to the lab. All specimens must be hand-delivered to specimen receiving.